Hi, my name is Dr. Sasha High, and I'm an internal medicine specialist practicing in obesity. Last week, we talked about weight bias and discrimination, and this week, I'd like to unpack obesity as a chronic medical condition and dispel some myths around the causes of increased weight. Myth number one, obesity is simply a matter of calories in and calories out. We used to think that obesity resulted from a lack of willpower to eat less and exercise. This misunderstanding of a complex illness caused the blame to be placed on individuals who have increased weight. But we now understand that obesity is caused by numerous factors, and weight is affected by your environment, genes, your biology, emotional health, lack of sleep, medical problems, and even some medications you may be taking. Even with the same diet or the same amount of exercise, people will vary widely in the amount of body fat or weight at which their body settles. There is neurohormonal biology that controls appetite and energy balance. What that means is that our brain actually controls eating behavior and whether we hold on to fat. Due to the biology involved, many health organizations, including the Canadian Medical Association and the World Health Organization, have now recognized obesity as a chronic disease. And this is important because only with this acceptance will the medical community and society start putting more effort into research, prevention, and treatment of this condition. We consider it a chronic condition because the reality is most people will need to manage their weight their whole life. It's also progressive and relapsing. Progressive because the normal course of this disease is ongoing weight gain throughout adulthood, and relapsing because weight regain after loss is normal. In fact, when you try to lose weight, you may notice that it becomes progressively more difficult. That's because your body is fighting against you by triggering hormones to prevent you from losing that weight. These hormones will cause your metabolism to slow down, so you burn fewer calories than you did before, and then increased feelings of hunger, more awareness of and enjoyment of food, and your body will do everything it can to hold on to weight. Researchers call this the starvation response. Obesity is not only a chronic disease, but it's also a major risk factor for many other health conditions, including type 2 diabetes, heart disease, sleep apnea, fatty liver disease, endometrial and colon cancer, infertility, and mental health disorders, to name a few. So it's important that we recognize obesity as a chronic medical condition, because if we don't, we're going to keep looking for quick fixes and magic pills and short-term solutions that will ultimately fail, instead of turning to proper evidence-based medical treatment. And that's the topic of my next segment. My name is Dr. High. Thanks so much for watching.